Okay, great. We're the two guys in the gray screen, and we just want to begin by saying thank you for allowing us to join your session today. To begin with, we just give a quick update on where we are in terms of statistics, in terms of outreach to businesses and service requests. We've had 1,644 COVID-related calls, complaints, and service requests this year, since March of this year. 93 of those remain open, which means that our inspectors are still in the midst of dealing with that particular call or service request. Recently as well, our public health inspectors have conducted or completed a round of long-term care facility inspections to make sure that facility operators, nursing homes, retirement homes are up to date on infection control measures and to ensure that the long-term care homes are operating in a safe manner. And we just started, I think, a round of daycare inspections just to make sure that those facilities are also following proper infection practices. As well, we've designated 2 health inspectors as workplace leads in case there's a positive case in a particular workplace, or if someone tests positive and had been to work within the infectious period. So that is very helpful in terms of outreach to business because you'll have someone there who will work through who's a high-risk exposure and who's not, and who has to self-quarantine for 14 days and who does not. Those who are deemed low risk just have to self-monitor. However, those who are considered high-risk contacts of a case in a workplace setting would have to stay home and get tested. As well, since April of this year, we've had a working arrangement with municipalities where we inspect and enforce the Reopening Ontario Act in places that we normally deal with, and municipalities do the same in their respective areas. That said, there's been quite a few changes in the regulations in the last 2-3 weeks. We're still operating under stage 3 of the province's reopening plan. However, within that, there's been some tweaks to the regulations, one of which was the staff screening, which we would gladly take any questions anyone might have, and as well the masking requirements that came out, I think, probably a week, 2 weeks ago. In regards to that, sometimes there is a lag between the provincial announcements and when we get to see the regulations. So we ask that you be a bit patient in terms of us giving you some definitive answers. In the case of the masking requirements, the public announcement from the province came out on a Friday, but we didn't see the regulation until Monday afternoon. So sometimes it's difficult in those intervening period to give firm direction to businesses and workplaces. That said, I don't know if I have anything else
No, this is Andrew speaking. I think he covered pretty well everything. We also did a round of public school inspections for the inspectors just before we did the long-term care homes. So
yes,
yeah. So hopefully that's a bit of a introduction there, and that if you have any questions, we're ready.
You're the two guys in the gray box.
So I have a couple of questions, and I think I might try muting you just to see if that works. We have a couple of questions, and I think part of it comes back to the whole masking policy and how that's supposed to work. Some of these may even extend into a legal component with regard to employment law, but I think the challenge for everybody has been when you're trying to balance a regulation or a directive from the health unit, an inspection with either bylaw enforcement or the health unit, and then you have employees who may or may not be able to be compliant. This becomes part of the challenge. So any recommendations, and I'll mute myself now, and maybe we can do the run between Roberto and even Andy and Philip.
Generally speaking, we encourage businesses to have a look of how the regulations are written, and if they have any further questions, to call us, and the health inspector will get back to them and navigate through their specific scenario. The regulations do state that any area where a person working in a business has interaction with the public, that both the employee and the public customer has to wear a mask. And it doesn't say a medical mask, it says a face covering. However, under that, there's a number of exemptions listed that would preclude someone from wearing a mask. And those include if they are being accommodated, if the employee is being accommodated under the Human Rights Code, if there's a reason not to wear the mask for health and safety reasons, and so on. We can, those are, I think, listed on our website, and we can forward those again to you. The interesting thing is the regulation does not require someone to provide proof that they are entitled to one of the exemptions. However, they should somehow explain why they are exempt from not having to wear one.
Yeah, and again, we realize this, you know, not that we drafted this, but we realize this puts everyone in a kind of awkward situation. You can't really enforce it. You can't press someone as to, you know, that you don't believe what they're telling you. So we just ask that you, at least in a friendly manner, remind them. It's more of an education thing, and ask. And if they say, "I can't, I have a medical reason," you just say thank you. And that would be the extent that we would expect you to comply.
All right, so we have a few people who are asking some good questions here. So I might give Kim Egan, or sorry, I might give Kim Egan the mic for just a second, because she's dealing with employees who are refusing to wear a mask. And the question really is, how does this play out for the health unit, especially if they aren't getting a response from the health unit? And I'm sorry, Roberto and Andrew, I know you guys have been pretty responsive to me, but I know that you are overwhelmed with both public complaints and requests from each sector. But maybe you could, I'm going to let Kim speak to this question. So Kim, you can unmute if you like, and I'll unmute Roberto.
Okay, can you hear me, Jill? Oh, yeah, great. So I guess the question is, it's not so much that the employees are not willing to wear a mask. It's in dealing with the exceptions and understanding that the mask wearing policy is fine. If you're sitting at a desk or sedentary, it's much easier to wear a mask. But when you are physically active and required to do certain things that require physical exertion, it becomes difficult, particularly for people who already have a breathing condition such as COPD or asthma or other medical conditions. So I would say generally the employees are trying to comply, but there's the exceptions, and then there's the question from the employees surrounding them in terms of, well, what does that mean for us when the individual beside us is not wearing a mask for one of the accepted reasons, even if it's just temporarily?
So in a case like that, I think if there's a legitimate reason why the employee or the customer can't wear a mask, I think we would then recommend, if possible, other control measures like social physical distancing and barriers. If you can put a plexiglass barrier to separate those individuals.
Yeah, that was basically what I was going to suggest, that you maybe have to reassign them specific duties, change their job a little bit, have them in, one area doing one task that doesn't involve interaction with the other staff. I agree it can be delicate because you don't want to infringe on their health concerns and put them under the spotlight, so to speak. But if they're obviously not going to wear a mask, other staff are going to know. So if you can just assign them other tasks that keep them away from other people, and remind staff that, you know, if everyone's doing the screening correctly, they are coming in healthy. You know, the masks are still important, but they shouldn't have as high level as anxiety as sometimes they do.
Yeah. And, you know, definitely the mask use is important when, you know, you're in contact for 15 minutes or more with another person in less than 6 feet. Sometimes people get really worried when they're passing someone in a hallway briefly and one of them is not wearing the mask. That type of scenario does not lend itself to transmission.
Oh, we're losing you there for a second. Oh, sorry, guys, we've lost you.
Working during up to 48 hours before they develop symptoms is, you know, what kind of contact did you have with your coworkers? Our communicable disease investigators will question everybody that worked with that person and determine whether you're high or low risk. So that gives you a bit of context there as well.
And I've had a couple of questions now, just asking about whether or not you are allowed to refuse service if someone comes in to your retail business, for example, or any business. And then on another note, maybe we could even go back to what is the current masking policy? This is a question out of Prince Edward County. And the other question with that is screening employees. So mask policy, screening policy for employees, and then what happens if somebody enters your business and you have a mask policy and defer them to curbside service.
Great question. Up until now, we've been talking about what's in the provincial regulations. We haven't been talking about, say, a house policy that someone may or a business may implement, similar to no shirt, no shoes, no service. So those policies can supersede or be more stringent than provincial regulations or even our MOH directive that we issued in July. Back in July and throughout August and September, we were getting calls and complaints from customers who were refused service, and they were quite keenly aware that our MOH directive did not instruct business to refuse service, but some businesses had put that into place on their own. And as a health unit, we can't prevent that. If a business wants to do that, that's their prerogative, and we would not, say, get in the middle of that.
Yeah.
So the other question on, oh, sorry. Did you
No, I'm just supporting what he was saying. I mean, yeah, it's your place of business. You really can call the shots in that respect.
And ultimately, if the person refuses to leave, it becomes a trespass to property situation, which everybody would likely want to avoid. Hopefully, things get resolved on the spot. But if it gets escalated, it becomes a legal matter with the police if the customer refuses to leave.
Yeah. And it's not we're advocating one way or the other here about, you know, refusing them service or absolutely allowing them in. As we say, it's your call. You can't win either way. I realize that, but the customer may be unhappy if you refuse them service, but the rest of the customers are probably appreciative. So yeah. It's your, again, you have to weigh those different factors.
I'm sorry, there was a question about screening?
Yes, please.
Yes. Can you go over it again one more time? Sorry.
Okay, sorry. I think maybe because I have you as co-host, for whatever reason, every time, and when we're both on the same line, it seems to do the double echo. So we have, the question is, how does the screening of employees work, or do we have to screen employees daily? And I know you and I have talked about this at length and what makes sense. Some it's relatively easy in my office because we have 4 people and we say, okay, you know what, fill out the survey and then sign off on this every day you come into work. And so we're not asking them to do a full-on survey every single time. And then, of course, you've suggested that we should keep that for 30 days, much as the restaurants have to keep it as well for tracking purposes. The government has not, or the MOH has not recommended any time frame that I'm aware of. Perhaps that's changed in the last couple of weeks, but you had recommended 30 days makes sense because that's what restaurants are doing. And that's the point is about contact tracing. So then we also have other organizations who are doing an electronic version of a form, and some people have used a mobile app. There are a lot of different ways. I think part of the underlying feature with all of this is that there's an expense and a cost. So part of the focus of this, or the opportunity we have here, is to demonstrate from a business perspective how the directives sometimes can be extremely challenging. So if someone has a process in place, should they be emailing you to see if it's okay? And what is the likelihood that you might even come in to inspect something if, or what is the likelihood that that tracking or tracing is going to be necessary? So that's a whole bunch of questions, but maybe you just start with the whole screening policy and how you work through that.
Okay, great question. So throughout this, there's been 5 tenets that seem to be working in terms of trying to control this pandemic. Hand washing and keeping sick people away from healthy people seems to be kind of top of the list there. Cleaning and disinfecting is also important, but those 2 things that I mentioned seem to be working best. So the idea with screening employees goes back to March, but mostly in the application of long-term care homes. But now it's been expanded by the government. The idea is to, if someone shows any signs of the illness, that they are excluded from work and have to go get tested. In terms of how that's operationalized, I think early on we gave you a couple of options that talked about the employee filling out the survey every shift, or someone else asking the questions and doing the paperwork. I think as well now we are quite happy if there is on entry to the premise every morning or every shift, if there is a list of the questions on the table and there's a log, people attest with their signature that they're healthy that day. So you don't have to fill out a survey every shift, but you would sign on the log that you came in that day at 7 o'clock in the morning and you were healthy at that time. Inspection-wise, I think a couple of scenarios could lead to an inspection. If we get a complaint from someone saying that the business is not following through on the screening requirements, or if we get a positive notification from the lab and the case had been at work during their period of communicability, which could be up to 48 hours before they show any symptoms, we would then go and speak with the workplace, those 2 workplace leads that I talked about earlier on, the 2 health inspectors, and ask the owner or the operator of the business who was working alongside that person up to 48 hours before they became symptomatic. And then the screening part, the log, would be good evidence to that. As well, recently, we've actually gone through video footage to see who was in contact with one positive case that we had recently. So those are kind of the 2 scenarios where we would ask to see that there's evidence that screening is taking place. Andrew?
Yep, no, I have nothing to add to that outside of, again, remember, this doesn't include the customers coming in, that this log sheet that we're asking you to keep.
And just once a day or once per shift at the start of the shift, and keep it for 30 days just in case. Keeping in mind the average incubation period for this virus is 2 to 12 days. The average with the median being 5.5, so we're giving ourselves an extra couple of weeks there.
So I would be interested to hear if Phil or Andy have any kind of the other side of that and maybe explain some of their experience with what's happening. Would you be willing to do that?
Yeah, Jill, I can. Essentially, we're following the public health guidelines. Our role, we see it more as working, in step with public health and as an education piece more than, a punitive. We're not looking to go out and issue fines, but more to educate the public on what the requirements are. And typically, what we do is refer them back to public health if they have any specific questions, such as being some of the ones that are being asked here today. And then, try to have a conversation and educate, the public, whether it's a, general member of the public or a business owner or somebody that might be working in one of the businesses.
Thank you. And what about you, Andy? Any thoughts? Like what kind of stuff are you hearing at your end?
We're pretty much have the same approach as Phil does with regard to education as opposed to enforcement. We try to have our media person send out notices and keep the building or the business community informed of what's required. But we haven't, and I haven't had any real complaints directed to our office other than we had some crowding issues on the streets in the summer. But we're also looking at how to deal with tourism. We've got a committee put together now to see how we're going to deal with this next summer, because I see it happening again. So we're coming up with policies to limit the or where people can stand outside of businesses, typically cafes. The ice cream shop was another location we had issues on Main Street in Picton. So those are kind of the issues we've been dealing with, and it is a public education. We have spoke to the business owners on occasion, threatened them with fines if they didn't adhere to the provincial legislation. But we're trying not to go down that road at this point.
Fair enough. Somebody has asked whether or not there's actually a log sheet available on the public health website. And I don't believe you have one. Kim from Kim Secrets has said that she took the checklist and just made a sheet for every day if they added yes or no to any of the questions. And I will have Roberto and Andy kind of comment on this. One of the things we did is we attached a sign-in sheet to each survey for each employee. And the survey is attached on the back of that sign-in sheet. And the front of the sheet says, by signing here, I'm confirming that none of my survey answers have changed to the attached survey. And I'm not demonstrating any additional or new symptoms related to COVID. So that the sign-in sheet is clearly indicating relevance or connection to that survey. Does that seem appropriate, or do you have any further recommendations?
Oh, yeah, that's appropriate what you described. I can say that the health unit approach, what we're doing currently for our office, is maybe even just a bit easier. We just have the questions posted at the entrance along with some sanitizer. And it's just simply a sign-in sheet that you're attesting to, that you've read the questions, that you're healthy that day. You print your name, you sign your name, and you put the date on. And that's pretty inexpensive and easy.
You can share that. And we can share that with you if you want to disseminate it to membership.
Okay, thanks. Yes, certainly. I'll share that with anybody who's attended today. We also have a question about what is the right for the employer to send an employee home that wants to work if we suspect they are showing symptoms of COVID. And the other question, I think, to add to that, what if somebody, how do we apply common sense to this? If I know that it's allergy season and I'm sneezing or I'm coughing or I'm developing some kind of seasonal symptom, or it might be a cold, and I've not been out of the community and I've not been in any other risky situation, at what point do we get to apply common sense to that perspective?
So that's a great question. I think it came up most recently when gyms and recreational centers were asking about that because it was in the midst of allergy season. And we bounced it up to our medical lead. And the advice they gave us is to look for new worsening symptoms or symptoms that are out of the normal default or baseline for that particular person. So in the case of allergies, if the person says, I've had allergies since I was a teenager, I'm pretty sure it's allergies, we would probably treat it as that. But if the person said, I've never had allergies before, but I'm feeling off and I feel like it's allergies, then that would be more suspicious if they've never had it before and they thought it was allergies. But if you have any questions about that, you can call us and we can give you some specific guidance on how to approach a particular situation. The right to refuse the worker from entering the workplace is in the regulation 36420. It requires the owner or operator of a business to follow the provincial screening document, and the document says that the person cannot enter the workplace. It doesn't state that specifically in a regulation, but if you go to the provincial screening document for workplace and businesses, it's in there. So I guess the operator would tell the employee that I have to exclude you from work until you get tested because I have to follow the provincial regulation.
Yeah, and you're right. It's common sense does click in here. I mean, it's kind of the approach they ended up relaxing a little with the school kids. For every little runny nose that they had, the kid would never be at school.
Another question on a different note. How many people are allowed at a table? Now, this is specifically to the county, but I think it probably is, unless the county has imposed something special, this would be for both Hastings, Prince Edward. So what is the limit at a table, 6 or 10?
In our area, there is no limit. Those numbers that you're mentioning apply to the high-risk hotspots, whatever you want to call them. That would be York Region, Toronto, Peel, and Ottawa. So right now we're in full stage 3. Those 4 areas are in stage 2 modified, and those limits apply there. That said, I think one of the main messages we want to get across today is that we are enjoying the benefits of stage 3, and if everybody follows the rules that are in stage 3, there's a greater chance or likelihood that we don't revert back to stage 2 modified as seen in Toronto and those other 3 areas, which I think are really hurting businesses. So a little plug there to follow the current regulations. We do get calls from time to time people trying to push the boundaries as to what they can do under the current regulations, and sometimes it's difficult to express that the regulation doesn't allow that, and and there's a good reason for that because we want to continue to be in stage 3. But there is a good chance if regulations are not being adhered to that we could revert back.
Okay, thank you. That's, and I guess when we have had our conversations, it's all about how does what we're doing prevent an adverse event? And that's ultimately the goal, is that we just don't want to have another case. And so I have another question, a little bit more along that line, and maybe you could speak to this more medically, regarding the assessment of the strength or mutation of the virus. Is it showing less lethal, which looking at the numbers and the number of hospitalizations, despite the number of cases, seems to be true. And what are we looking at with regard to the transmission load? And when we hear that there's been a case related to close contact, is that close contact with someone locally, or is that close contact with maybe somebody in a different community?
We're not experts on how the virus is mutating, so we can't really comment on that. I don't think we've heard any evidence that it is.
I think there's been some, perhaps less lethal, I guess what you were saying. And I think part of that is more that the doctors have had time to work out more of how to handle the symptoms better and what treatments work and what doesn't. So they're having much better success in responding to the symptoms, so that people aren't getting in distress with breathing. So I think that's the success rate, and that's the effect on the lethality. And what was the other part?
I forget, but I'll give you an example of how control measures have a huge impact on business and their ability to continue to operate. We had a recent case that presented at the hospital, symptomatic, wasn't serious. They were eventually discharged, but when we did the interview with the case, we found out that the person had been to work during their period of communicability while they're infectious. So we were in contact with the workplace, and we found out what was the measures that were in place. So in that particular workplace, there was a barrier between the staff and the customers at the service counter. There was good mask use throughout the store. Out of the entire workforce, only, and this is a quite large workplace, only 7 co-workers were deemed to be high-risk contacts. None of the customers were, because of that barrier was in place. So there was no need to do a public notification saying, you know, if you've been to X business between the dates of October 4th and October 8th, you should go get tested. So 7 of the employees had to self-isolate and get tested, but none of the other staff, and there was probably 3 times more number of staff in that workplace. So those individuals were considered low risk and just had to be self-monitoring for symptoms. So that's a good example where control measures, when we, public health, had to be called in and look into the practices where that helped that business continue to operate without having to close down for a period of time. I'm not sure if that helps, but I think that's a good way to illustrate how small little things in compliance with the regulations are useful.
Thank you. No, that makes sense. And to your point at the beginning of the session, where you mentioned that there are kind of 5 different approaches to managing the transmission and the spread, and that it's each one of those things in part that have kept us safe. So it's not just wearing a mask, it's not just hand sanitizing, it's not just staying home when you're ill, and it's not just physical distancing. All of those things have to come into play. And by making sure that everybody does that, it helps to keep us safe and keep us into this stage 3, stage 4. There is another question from Laura here about the federal benefit. And I don't know that this is the venue, but if you have any context on what can happen with regard to federal funding, I'm not sure. I think there's still something in place with regard to, it's not under CERB anymore, but there is something. But if you want to join us at 12:30, or we'll be recording that call to confirm what's available if someone has to leave work due to COVID, or caring for a member has COVID. Do you want to comment on that?
So yeah, federal benefits or even provincial ones, we are not experts or can't speak to that in terms of what's available. We just know what we hear on the news, so to speak, and what may be announced from the different government levels. So we can't really speak to it. I would recommend that businesses and employers call the Service Canada phone number or contact them through their website to ask about what the options are.
And again, we'll have another session to confirm kind of if there's any end in sight to some of those funding programs. Certainly that will be part of our conversation with MP Neil Ellis later this afternoon, or earlier this afternoon, just to talk about, you know, some of the impact of the funding programs that have been extremely helpful, but with a second wave in place right now and the impact on business probably extending through next year, we certainly think we'll be advocating for an extension of a lot of that stuff. So I'm just wondering if there are any other questions here, just looking through. Of course, the comment that COVID has removed all common sense, I think we could probably all agree that we all struggle with how to make this work. And we rest in a community that has been relatively safe. I think the other question I had for you with regard to the transmission piece was when we hear about a new case that has been attributed to close contact, it's not really clear if that's close contact due to travel, if that's close, because if there are only 4 active cases, is that close contact to an existing case, or is that close contact to an existing case in a different location? Any ability to shed light on that?
So there's a definition of close contact in the ministry case management guidance document, and it's defined as living with someone or having close prolonged contact within 2 meters with the person during their infectious period, providing care for a person without consistent or appropriate use of personal protective equipment, direct contact with infectious bodily fluids, or living or working in a facility or outbreak. So those could happen anywhere. You know, it could happen locally here. It could happen if someone travels out of our area and goes to visit a friend or family in another area when we've had cases like that. Those on our dashboard, I think, are captured as travel related, but when you drill further, there was probably close contact, whatever that person traveled, whether they were in London or Windsor. It's most likely that it happened through close contact there, but they're captured as travel on our dashboard. And the local cases that we tag as local are usually close contact as well. Generally speaking, when we investigate, there's usually a close contact component to that. Very rarely do we have an unknown transmission where we can pinpoint how the virus was passed. So close contact is usually what's driving this pandemic. And the one thing I should mention, though, in relation to that is we're very good in terms of doing our contact tracing now. So we have staff working 7 days a week. So if we get a lab results on the weekend, we will contact the case, the person who tested positive right away, and trying to find out who their contacts might be. So in the context of a workplace or a business, public health will be contacting the operator or the owner and determining, you know, we've been speaking with the case. They've indicated that they were in working on Monday, Tuesday, Wednesday. We have reason to believe that that was during their infectious period. Who else was working with them? And we will then give guidance as to which employees have to stay home and which ones can continue working. So I think that's really useful. In other jurisdictions, contact tracing has really fallen behind because of volume. So we're, knock on wood, right now able to meet the needs of workplaces and businesses in terms of helping them out as to which workers have to isolate, which ones don't have to, whether you need to close down for a while to clean and sanitize or not, that sort of thing. So I mentioned that there is that support there, that our nurses, our health inspectors, and our health promoters are working 7 days a week to make sure that that is happening.
Oh, and confidentiality, just,
Yes.
you know, is considered personal health information. You know, we do not try to go out of our way to, you know, out of business. It says that they've got cases there. You know, that would only happen in the case of, you know, in general terms, if someone, you know, contacted a large workplace where a lot of the public had access to between a certain time frame, and we might have to have a general statement. If, you know, if you visited this premises on these 2 days, then maybe, you know, you were at risk. But in general, you know, this is not public information.
Yeah, and within the workplace, that's a great point, Andrew. Within the workplace, the same thing applies. So if you have a workforce of 10 people and 2 of them have to self-isolate and get tested, we do not recommend that everybody is told the reason why. So that's something we ourselves don't do, and we wouldn't recommend to the owner operator to do that as well. We get calls sometimes from HR people who are not sure what their obligations are to the rest of the staff who continue working and just have to self-monitor. And the answer there is to not divulge the reason why 2 people had to be off work.
And I can imagine that's an ongoing challenge for sure, because people are curious. They want to know what their risk is. They also, I think we're all curious about how this disease is spreading, whether or not we can try to begin to predict, you know, whether or not we're safe and how quickly this will just stop and go back to normal. And I think that maybe is the motivating factor. I do have another question, and we're at 10 to 10. We'll be ending this about 10 o'clock. So any last minute questions, please throw them in the chat. We're watching them carefully. I do have a question from Maxine, who's asking about long-term care and retirement homes. They're making COVID-19 testing for essential visitors, but not all staff are being tested biweekly. Is this a recommendation or mandatory? And maybe that speaks to asymptomatic testing viability. If you have any comment on that.
There is a standing directive from the Chief Medical Officer of Health to all long-term care homes and retirement homes in the province. I think it's called Directive 3, unless it's been updated. And in there, it states what the requirements are for testing for staff and visitors. So if there's any questions that anyone might have about a particular home, feel free to contact us. Our main number, and then extension 349, that goes to our communicable disease team. And those individuals on that team are in very frequent contact with the operators of the homes. And if there's a gap somewhere in the testing protocol, we will address it then. I can't speak to the actual specifics. Maybe Andrew, you can, as to who's required to get tested when.
Yeah, I'm foggy on it.
It's all in that directive. And if you call us, that information will be kept confidential. We don't divulge who called us. We will just follow up with the home if there's a need to do so.
That number again?
613-966-5500, extension 349. And you're out of area, it's 1-800-267-2803.
Just typing that into the chat. Okay, Phil or Andy, do you have anything else you want to answer? Like, if you have anything you might want to add about the kind of complaints or situations that you're dealing with, anything that you can recommend to our variety of business people here today?
Not really, Jill. I would just say, keep an eye on the public health directives. I know it's, it can be a bit daunting, you know, we're kind of in the same boat as everybody else. You know, we're watching the news every day to see what the province does. You know, at the municipal level, we're not necessarily getting this information ahead of anybody else. You know, we're hearing it pretty much the same time as everybody. So, you know, always better to ask the questions first than try to guess what the answer may be, and maybe, you know, you get it wrong and you run into some sort of issue. So really, you know, just keep up the communication, and you know, feel free to reach out to us. You know, if we can give the answer, we do. If not, we, you know, we'll direct you to public health.
And Andy, any thoughts?
Yeah, I'd agree with Phil. We're pretty much following the same process. Being complaint driven by law enforcement and having limited resources, it's basically, if we get a call, we'll look into it. But the biggest thing is just making sure the information is out there for the business owners and the public as to what the province is requiring.
That's great. And so last thing I'll ask from you, Andrew and Roberto, I'll throw another number out here. Who should they contact if they want to have a business wants to have their accommodations or their compliance measured reviewed? Who should they call?
I'd say call Andrew directly.
And I was going to say Roberto directly, but I think really, you know, we'll assist and offer some guidance, but actually, you know, in terms of reviewing and like kind of drafting the business's operational plans with regard to this, it's not something we do. We would direct them to the website and ask them to look at the resources available. And if they have specific questions, absolutely, we'll do our best to answer them. But there's just too many people that would want us to review their documents, and it would be too unwieldy for us.
Yeah, that's a great advice. Usually our first point of contact or our first recommendation is to suggest that the caller have a look at our website and our various resources and read through those. And if there's any specific questions, to call us back, and our health inspectors will gladly engage and answer any questions. Our intake line, which is another option on our phone menu, if it's a very quick, simple question, they will also address those. But if it's a more complex situation like gathering limits and that sort of thing, they will pass it on to the inspection division.
And that number, please.
I think it's the same numbers as we just provided you for the other scenario, and I think the call on the touchpad is number 4 for the intake line. For the inspection division, we have a different extension. It's 677.
Perfect, thank you. So I have the 613-966-5500 extension 349 for general inquiries, and then we have the intake line, which is extension 4, number 4 on the keypad when you call 966-5500, or if you're looking for the inspection division, you're going to extension 677. And if that concludes our thing, I don't see any more questions in the chat, so hopefully anybody has been able to gather some information. We have recorded this and we'll be posting it. Keeping in mind that some of these directives change daily, so the advice provided today is really in context with the moment as of October 22nd, 2020. Anything else from you guys, Roberto and Andrew?
No, I don't have anything. Available anytime you guys have questions.
Yeah, we're here to help. If you do hear something on the news, a new change, a new regulation, feel free to call us. There might be a lag of a day or two before we get the actual fine details and we get access to the actual changes in the regulations, so bear with us. We may tell you that, call back in a day or so, but otherwise, we've been at this for quite a while now. I think we're hitting our stride in some areas, but sometimes, there's new things that require a little bit of more time for us to have our strong footing underneath us. So, but nonetheless, we're here to help. We're a public service, so call us if you have any questions or concerns. Oh yeah, get the flu shot. That's a good one.
That's just one more plug from us. Get the flu shot.
Okay, so I just want to say thanks to everyone, the city of Belleville who has supported this event today, and everybody who's joined us on this call. I hope you found some of this information helpful, at very least to understand that we have a strong relationship with the health unit and each municipality who's trying to assist with the enforcement of the regulations to, cease the spread or contain the spread of COVID so that our community can remain in the current level of business activity that it can be. Like I say, this is the third call we've had with the health unit now, and we usually make these available to anybody in the community. We found them, even though they can't change the rules, they're usually pretty helpful at explaining how to manage them. And I would encourage you to call those numbers or reach out if you have any other questions. So again, recording will be available later today, and look forward to seeing you hopefully at our session with Todd Smith. It will start with a roundtable discussion at 10:15. The actual event with Todd will begin at 11, and then he'll join us. And this is an opportunity for us to roundtable some of the concerns and challenges we feel with the initiatives coming down from the provincial government, and whether or not we have an opportunity to advocate on behalf of our local business through Todd to Queen's Park. So thanks everyone for joining us today. We'll talk to you again soon.